In the Netherlands, patients as young as 16 can request assisted death, and it's not just for terminal illness. It can include psychiatric suffering, like depression. At 16, Iris applied to die under what is now called psychiatric euthanasia. Euthanasia started as a way to give dignity to people suffering from terminal illness, but over time it has expanded. Cases are still rare. In the Netherlands, there were 174 cases of psychiatric euthanasia in 2025, only 1.7% of euthanasia cases. But with euthanasia as an option, the conversation can quickly move from recovery to an exit plan. In the case of Iris, doctors told her that her depression was treatment resistant, and after trying everything, ketamine therapy and ECTs, she was finally told there's nothing more we can do. One psychiatrist put it like this: euthanasia starts to appear as the only solution.
I want to make sure when we talk about this, we talk about it in a very careful way that removes our own feelings and emotions and moral obligations with respect to euthanasia and psychiatric illness. And I want to give my general take on psychiatric euthanasia. First, without a doubt, we should recognize that people suffering with psychiatric illnesses are going through a lot of pain. So the suffering is real, whether or not we agree or disagree on the solution to the suffering. However, the thing that typically separates psychiatric disorders from other well-defined and well-measured medical disorders is the uncertainty around prognosis, treatment, and how a person evolves and grows throughout their life. I think everyone can confidently say, I'm a different person today than I was 5 years ago, than I was 10 years ago, than I was 20 years ago. And my attitudes, my mood, my level of anxiety, the things I would have anxiety about have all changed as I change. So with a cluster of disorders that tend to evolve over time with or without treatment in many cases, so offering a permanent, life-altering, and in this case, life-ending decision to what is and can be very likely a temporary issue seems very unethical. A congruent example would be if I broke my humerus and the pain is unbearable and I do not want to go through the physical therapy is not working, the bone doesn't heal correctly, the next step, the only viable solution, would be to amputate my arm. I'm not sure there are many circumstances in which that would be the next likely step, assuming my arm is not infected or gangrenous or anything like that. In psychiatry, we deal with a lot of complicated and very vulnerable and dangerous emotions and ideas from the patient. But I will stand on the ground that offering compassion for somebody does not include validating self-destructive or life-ending ideas.